Hi, Paul Slackus, Good News Broadcast, speaking to Dr. Robert Sallis. Hi, Doctor. How are you?
Hi, Paul. I'm fine, thank you.
Excellent. Media past president, American College of Sports Medicine, and chair of Exercise is Medicine. Exercise is Medicine national campaign urges people to get active to stay healthy. All right, doctor, this is important. They got a great website. I was just looking at it, and so what is it about exercise that helps to keep somebody in a more of a healthier way of life?
Well, exercise has a tremendous effect on preventing chronic diseases and extending life. There has been just research study after research study over the years documenting the benefits of exercise. It really is like a medication, and the goal of this initiative is really to get physicians to think of it as a medication, to think of it first, to prescribe it as the first-line medication, so that when they have a patient come in with diabetes or they have a patient who comes in with high blood pressure, the first thing they prescribe is exercise, and if that doesn't work, then we go to medications. And so we're really trying to get the word out. We're trying to get physicians on board with this message, and that's why we've partnered with the American Medical Association that represents all the physicians in this country to get out to physicians and say, you need to be prescribing this like a pill, because the evidence is there to warrant doing this.
Okay. Now, who's partnering on this? What do you mean partnering?
The American Medical Association and the American College of Sports Medicine, and the Coca-Cola Company is our founding sponsor, and they've helped us tremendously in getting the word out about this. But we were the two founding partners, and then we've got about well over 100 other medical organizations from around the country that have also signed on to support this idea and are trying to promote it within their organizations.
Now, there's a free public toolkit, right, on your website that you can download. Is that right?
Exactly. If you get on the website, www.exerciseismedicine.org, you'll find this toolkit. There's a tab on there for the public. You click on that, and it takes you to a toolkit that's downloadable for free. And what it does is it really walks you through the essential steps in getting started. So if you are not doing anything, if you've never really been a regular exerciser, take a look at this website, and it'll give you an assessment of how ready you are to start an exercise program, and then it walks you through step by step what you need to be doing to improve your health.
Okay, so I'm looking at the website right now, Exercise is Medicine. Well, first we have something for physicians, right?
Right.
Then there's something, and so physicians, this is encouraging them to suggest to do exercise?
Yeah, we've got this site for physicians that's got some useful resources for them. There's actually a toolkit for physicians that includes an exercise pad that you can use to print out and customize so that you can write exercise prescription. There was a recent study that showed physicians who actually wrote it out to their patients like they were prescribing a medication, the patients were actually more likely to carry it out. So we've got that on there. We've got some other valuable tools and resources for the physician. We've also got a link for health and fitness professionals. They're an important part of this initiative to help get the word out. And we've got a whole industry focused around getting and keeping people more active. We've got to merge that with the healthcare industry. We've got to get the patients who really need this medication to the health and fitness professional who can help them understand how to take it. And then finally, that tab for the public, that's where the general public should go and to find the resources that will help them get started.
Okay, you even have something here for the media.
Exactly. We really need your help in getting this word out. We've done a great job with smoking. I think that nobody in this country could say that somewhere along the line they haven't heard how dangerous it is to their health to smoke. But I don't think we could say the same about inactivity, the lack of exercise, how dangerous it is. We call it the sedentary death syndrome. And it's really, I think, the major public health problem of our time is people are just not active enough.
Well, let's talk about in that you are a medical doctor, right? And
exactly.
Let's talk about heart, okay, which seems to be on the top of the list, one of the top ones, right, of concerns.
The number one killer in this country is heart disease. Okay,
heart is a muscle, right?
Exactly.
What is a heart? And if you don't exercise the muscle, exercise that part, or you don't do aerobic kinds of things, what is it that will happen?
Well, it doesn't. The heart weakens when it's not used, just like any muscle. It atrophies and it becomes not as functional. And so by consistently working the heart and the blood vessels, which it pumps the blood through, it keeps them more elastic and less likely to be diseased and deteriorate. Just like any muscle, if you don't use it, you lose it, and it begins to atrophy and not function properly.
I think most people don't realize it's a muscle. I think most people, you take your arm and you make a muscle in your arm, and you can say, oh, that's a muscle. But to think of a heart as a muscle, I don't know if that is in someone's mind, that it needs exercise.
Well, it absolutely is a muscle, and in fact, you see, as people, the hearts of athletes are much larger than the hearts of non-athletes because it is a muscle, and it gets bigger when you work it and strengthen and stronger.
Is that right?
And more functional, absolutely.
It literally will get bigger, that muscle, by exercising?
Exactly. Yep. If you look at the heart of an athlete versus a non-athlete, you could tell the difference because the athlete's heart is larger and stronger and pumps a greater volume.
Somebody once told me, I don't know if this is true, but one of the good things that you should consider when you're exercising is getting your hands above your heart to stretch out that and muscle. So, like if you're doing those jumping jacks or things like that, or just stretching, is that true? Do you think?
I don't know how. I can see the benefit of that in terms of range of motion and flexibility, and also lifting your arms above your head puts an added stress on the muscles, and working those muscles of the upper extremity. I tell you, particularly women lose upper body strength because they don't do enough lifting and moving their arms overhead. That as they get older, and it can really affect their quality of life, this loss of muscle strength. So that's why weightlifting is an important component of fitness as well, doing some type of resistance training to keep those muscles strong. And in the same fashion, flexibility is also important. Moving and maintaining your joints through a full range of motion really can help your quality of life as you get older, because we tend to lose it if we don't use it.
What do you think about, I'm becoming a yoga instructor, what do you think about yoga and that kind of more, even though once you get into yoga, you're doing some sweating and some serious stuff and inversions, getting your head below your, part of your body and blood flowing, things like that. What do you think about that?
I love yoga. I think it's a great exercise because not only does it work your heart, it gets your blood, or you get your heart rate up, get your little sweat going, but it also works on flexibility. So you're really taking care of two things with one, and it gets some resistance in there too. You really incorporate all those important parts of being a fitness program into one exercise, and that's really unique. That's what makes yoga such a great exercise. And particularly folks who have problems like, they got arthritis in their knee where they can't go for long walks or jog. Yoga is a great alternative exercise program.
Okay, two more quickies. One is it's a big one. Diet. Any thoughts here?
Yeah, it's important to understand that, and particularly with regards to weight control in your diet, you've got two components to controlling your weight. It's the calories in versus the calories out. So the exercise works the calories out part of that equation. The more you exercise, the more you can eat and maintain weight. The less you exercise, you got to cut back on the diet more. But I also want to emphasize that don't get fooled by what the scale says. And I have so many patients that are discouraged. They say I've done exercise for a couple of weeks, the scale hasn't moved. You still have to understand you're getting those same benefits no matter what your weight is. And if your weight doesn't change, it's still beneficial to you. So don't get discouraged by the scale. Work on that exercise. You can do that. I think it's much harder sometimes to get the diet to reduce the calories than it is to get on an exercise program. But if you do that regular exercise, you can be assured that you're getting those health benefits.
I'm writing the book Bare All Diet. I went against my landlord and I filled it. And April Fool's Day was the deciding day. And whoever lost more weight did not have to stand in the window naked on Flatbush Avenue here in Brooklyn, New York, okay? Thank the Lord.
Well, best of luck on that.
I won, but now we're back to May 1st.
Okay.
Last question. What's good news for you, Doctor? What's good news?
I take our website. I think that will give you some good news, www.exerciseismedicine.org.
I agree with you.
Take a look at the public toolkit. I think you'll find something helpful there that's going to help your quality of life, help you live longer, live healthier. This is the answer.
I agree with you entirely. Great website. Congratulations. Thank you very much for coming out and doing
this. Thanks, Paul. Appreciate you having me.
Coca-Cola, too. All righty. Bye-bye.
Thank you. Bye-bye.